And that leads me to ask this question. Of those in the room, how many of you were in Rotary in 1985? Would you raise your hand if you were here? Can any of you tell me what happened in 1985? Sorry? Well, it was not women. It was still an all-boys club. Okay, Diane, were you a member in 85? But Diane, do you remember what these other men do not remember? What happened? Yes, yes, a woman got it, yes! All right, boys, step up to the plate, right? Okay, yes, in 1985 was when we first started to do the eradication of polio. And since that time, Rotary has contributed $1.3 billion, which has protected over 2 billion children. And when we started in 1985, there were 350,000 cases of polio in the world. Today, in 2014, there are less than 400 in the world. But we still are asking you to give money to polio. And often we hear the question, what's in it for me? I live in the United States. So I thought it might be interesting to have a perspective from someone in our own community who has been involved with polio and other infectious diseases. So today our speaker is not from the Columbia Museum of Art. Our speaker today is an adjunct professor at USC, Eric Brenner. Dr. Brenner is an internist and a medical epidemiologist. And he lives here in Columbia. He has a stoic career. He has served in positions with the Center for Disease Control, with DHEC here in South Carolina, and also with the World Health Organization. He recently returned from a trip to the Ivory Coast, where he was helping them with their Ebola preparations. So he's knowledgeable about what Rotary is trying to do in the world and other kinds of things in regard to that. So please give a warm welcome to Dr. Eric Brenner.
Thank you, Paula, for a very kind introduction, and it was a pleasure to join this particular Rotary Club. I've been a speaker with some other groups in town. I live near 5 Points, so I've been with the 5 Points group, Vista, and so forth. It's a pleasure to come out here to Polo Road. As you said, I just came back a week ago from 6 weeks in the Ivory Coast, or Côte d'Ivoire, as they say in French. For those of you who don't have the map of West Africa in mind, the Ivory Coast is not one of the countries which has been affected by this terrible Ebola epidemic. But the Ivory Coast shares borders with both Guinea and Liberia, which would be a bit as if there were Ebola in North Carolina and Georgia, in Augusta and Charlotte, and we'd be sitting here wondering what's going to happen next and how we'll be ready. When people ask me what I do all day, I say, well, I'm thinking about tuberculosis and Ebola and meningitis and hepatitis and influenza and measles and whooping cough and polio. So it's a little bit of an unusual way to handle things. I don't deal with individual patients. My interest and concern is kind of the big picture, what's happening in our state, what's happening in our country, what's happening around the world. Infectious diseases, since you could be on an airplane in Africa or Asia or Australia in the morning, and by evening you could be right here in Columbia, South Carolina. So for infectious diseases, the world is really not very small. What I thought I would do is show you some slides dealing with polio eradication. What's happened in those years since 1985, which you mentioned. I had not realized that Rotary started that early, because the global effort to eradicate polio really was not made officially official until 1988. So I'd say Rotary was even ahead of WHO. So if we could have the slides on, I don't have slides here with a laptop, so I can see the screen in the back there, but I will try to work this gadget. Yes, here we are. All right, good. If you ever need to have an update about polio, you can go to www.polioeradication.org, and this is very well kept up, and you can find the latest information on what's happening around the world. And this is also on the web page here. And if you look at the bottom of the page, you see logos of important organizations which are the key players in polio eradication. So we see, of course, the World Health Organization, UNICEF, Centers for Disease Control, as you might expect. Well, what do we see right in the middle of the picture is Rotary, right up there with these major organizations that reflects the important role and contributions which Rotary has made over the years. So you've seen slides like this before. The long-term vision is a polio-free world. And I like this slide a lot because it shows various prominent people administering polio vaccines. So we have Nelson Mandela, Bill Clinton, who was that? Oh, Bill Gates, who you mentioned before, in conjunction with the nerds winning, is that right? That worked out very well. And actually, we'll come. Actually, it's important to know that the Gates Foundation has a lot of keeps an eye on the Rotary. I think that for every dollar that Rotary contributes towards polio eradication, the Gates Foundation will contribute up to a maximum, I think, of $35 million a year. So there's been a close partnership between the Gates Foundation and Rotary. And we even have Mother Teresa on the bottom right, giving oral polio vaccine to a child. Okay. This Paula mentioned already, the Rotary has contributed $1.3 billion. It's staggering to think not just in terms of thousands or millions, but billions. I'll show you later what it costs to vaccinate children, not just in Africa and Asia, but if you do the calculation for the USA, that can help put some of this in perspective. So polio is a very old disease. We have evidence that even ancient Egyptians had it. And this probably would have been a poster, I guess, from the 1930s or 1940s. And in many countries around the world, when you walk around the streets, you see people who are lame, well, for various reasons, but many of whom are lame because of polio. This is rather dramatic here. You see children who were paralyzed, usually early in life, lost the use of usually their lower limbs. It's important to remember that polio can paralyze not only the legs, but also the muscles of respiration. And of course, if you can't breathe, then you will die unless you are in some kind of breathing machine. I'll show you some pictures of that in a moment. But when we're talking about eliminating polio, this is what we're trying to do. Young students nowadays may not know that President Roosevelt himself had polio. In those days, I think back in the 30s, the press was a little more discreet. And when President Roosevelt would come to give a talk, he would come in on a wheelchair, walk up to the podium with his crutches, but the press would not take pictures until he was standing there, and then you couldn't see his braces and so forth. So I think nowadays the press would be a little more aggressive than that. So this is how the American public knew the president. Here he is giving one of his fireside chats, must have been in the 1930s. We see him sitting down here with Stalin and Churchill. This must be at the Yalta conference, kind of planning for the post-World War II era. This is an interesting picture because if you look carefully, so here's the president. Actually, they're establishing what we now call the March of Dimes, which is instrumental in helping raise funds to eradicate or to eliminate polio in the USA. We have to look very carefully, but can you see on the shoe there? He has braces. So that would be about as indiscreet as the press might have been in those days, just recognizing the president's handicap. This is I think in Warm Springs, Georgia, where the president used to go, and here's a rare picture of him in a wheelchair. And this I took myself in Washington, D.C., how many of you have ever been to the FDR Memorial? It's a number of you. It's a very moving place to go. So here's D.C., and here's the Mall, and here's the Capitol, and then Lincoln Memorial. And the tidal basin is here, with the Jefferson Memorial on one side, and here's the FDR Memorial there. Very interesting place to visit. What is this gadget? This is a so-called iron lung, where people whose respiratory muscles have been paralyzed, and these would have been used mostly in the late 30s, 40s, and early 50s. And if you couldn't breathe, this is actually in some ways better than being in a modern intensive care unit where if you can't breathe, you have a tube which comes down into your trachea, and air is pumped in under positive pressure to inflate your lungs so you can breathe. In this case, you had to be in a machine, but there was nothing in your mouth. So here you see a doctor and nurse taking care of a room full of polio patients. Mothers of children, if you're a young mother, say if you're 30 years old now, then you've been born around 1985. So a young woman born in 1985, when the U.S. was already polio-free, does not have any memory of what things were like in the early 50s, when we had thousands, indeed sometimes tens of thousands of cases of polio every year in this country. This is especially dramatic here to see. This would have been in the early 50s at a major medical center. So we're talking about contributing to polio eradication worldwide. These are some of the images that it's worth keeping in mind. This is interesting. This is like a double-decker van. Two kids on top, two kids on the bottom. But the nurse or maybe the mom could come in and read stories to those children while the ventilation was being supported, and hopefully they would recover their ability to breathe somewhat and wouldn't have to spend their entire lives in such a machine. There are still some people living now who were children in the early 50s who can breathe, at least during the daytime. They can remember and force themselves to breathe, but spend their nights in a machine like this. It's kind of a dramatic reminder of the past here. Polio is a little unusual in that compared to measles, for example, if you've been reading about measles in California and on the West Coast, measles is transmitted by people who have measles. And you can see they have measles, they're sick, and they have a rash, and so forth. But with polio, a lot of the transmission of the virus is occurring from people who are not sick. That is, people who are sick are just the tip of the iceberg. That's what they're showing here. I think you have here's the general idea. If you infect, say, 200 people with the polio virus, about 180 will be symptom-free. They are infected, but they're not sick. But the virus is being shed in their poops, in their stools. So in conditions of poor hygiene, other people can become infected. And maybe 19 of them would have some mild illness, just a little fever and a headache and so forth. And the doctor would say, oh, don't worry, it's just a virus. It is just a virus, it's polio virus. But about one person in 200 will get paralyzed. So whenever you hear that in a certain place or country there's been one child or 10 children who are paralyzed, you have to multiply that by 200 to get some idea of how much transmission has actually been taking place and what interventions have to be made. Just as ice cream comes in chocolate, strawberry, and vanilla flavors, making what in my day we used to call that Neapolitan ice cream. That's still a term that's used. It goes back to an earlier generation. So poliovirus comes in 3 flavors, called type 1, type 2, and type 3. And some people are saying, gee, you've been working on polio eradication now for 30 years. Looks like you can't do it. But the fact is that polio type 2 is now gone. It's gone for about 12 years. There's no more type 2. And type 3 has not been seen worldwide, I think, since 2012. That may be gone too. So actually, even if you, aside from counting the numbers of cases, if you look at this from the point of view of a virologist, the job is already 2/3 done. We're just really, for all practical purposes, left to type 1. Here's some pictures from the past. This would have been from about 1954, 55. Salk vaccine use. Jonas Salk giving a child a little injection there. Golly, if Elvis is getting vaccinated, then it must be okay for the rest of us too. So here's Elvis. This would have been in the 1950s. Notice this is an injection, and this is before we had the oral vaccine. Polio is a bit unusual that we have really two different kinds of vaccine. One was given by injection, one which is given orally. So the Salk vaccine is given by injection. Here's Salk, Man of the Year in Time magazine. And here's Albert Sabin, and he's the father of oral polio vaccine. It's been very interesting in the US. If you were a child yourself in the mid or late 50s, you would have gotten injectable vaccine. But if you were a child then later on in the 60s, 70s, 80s, and 90s, you would have gotten oral vaccine. And then for a while, pediatricians recommended first injection and then oral, and now the US has switched over completely to the injectable vaccine. You can't even get oral vaccine anymore in this country. But in much of the world where polio, at least in countries that are at risk or still have polio, they use oral vaccine. And say we're giving a child drops here. This is the kind of thing which I would discuss in class and take an hour to discuss the whole thing. But each vaccine has advantages and disadvantages. The main disadvantage of the oral vaccine is it can rarely cause vaccine-associated paralysis. About one child in 2 or 3 million may get polio from that. That's why we stopped using it in the US, because we had the risk of getting polio from poliovirus was zero, and we have 4 million kids born every year in the US, so you might have 2 children a year who would get polio from the vaccine. That was justifiable if we had thousands of cases, but it wasn't justifiable if we had no cases. Therefore, the US switched over entirely to injectable vaccine. But in terms of being able to eradicate polio from the whole world, then the oral vaccine has many advantages. One of which is the price. In the US now, well, so if you were mom or dad or grandma or grandpa, so these would be the typical vaccine schedule that would be used. IPV means inactivated poliovirus vaccine. That's what kids get with the little babies, and a booster shot when they go to school. And this is a different schedule. This is what's done in many developing countries. It's interesting to see that in many countries you give a dose at birth. Up, baby's born, quick, give baby polio drops. It doesn't count as one of their 3 doses. That's why it's not full dose 1, it's dose 0. Why is that? Because in some places that may be the only contact the baby has with the healthcare system when they're born. You've got the baby in your hand, might as well give it 1 dose. It's only partially effective, but that's better than nothing. Okay? My own medical training was back in the 70s, and that was the decade in which smallpox was eradicated from the planet Earth. And after smallpox was eradicated, people said, gee, what is the next disease that we might be able to eradicate? So the big committees met and so forth with the recommendations of the Task Force for Disease Eradication, 1993, and polio was at the top of the list. This is 93. By that time, Rotary had already been working on this for about 8 years, and WHO already in 1988 at the World Health Assembly, which meets every May in Geneva, Switzerland, had already taken a stand saying, all right, the world should try to eradicate polio. They had said by the year 2000, and it became 2010, now we're talking 2020, it's been harder than we thought, okay? Who are the main players? You see there, Rotary right up with the others that we mentioned, and then also, a number of others. Gates Foundation, you mentioned, the UN Foundation is very important. Ted Turner, is that his name, the father of CNN, gave something like $1 billion to the UN Foundation, much of which is going also for global immunization. So there have been not only government and international agencies, but numbers of other partner donors involved here. This we could talk about at some length, but in this country we just use routine immunization. When the child's ready for, at a certain age, he gets his shots from the doctor. In many countries, because vaccine coverage is so low, that is, the number of children who get vaccinated according to schedule might be low, might only be 50 or 60 or 70%, and not the 80, 90, 95% that you would hope for. Therefore, those countries also have mass campaigns, and there's a certain day of the year, or like, let's say, on March 1st, we're going to have a big program. We're going to try and reach every child under 5 oral polio vaccine. And you mobilize medical students and nursing students and Rotary clubs and communities and the post office and so forth. And you have people actually going house to house giving oral polio vaccine to every child. That's meant to help to really saturate the country with polio vaccine, which can kind of ecologically displace the wild polio virus which causes disease. Okay. These are pictures of the Emergency Operations Center. This one must be at CDC, and this is at WHO. And the concept of EOCs has now become very important. South Carolina has an EOC, so in case there would be a natural disaster like a hurricane or something, it's a place where the governor could go and different state agencies would be there, the highway patrol and so forth, and they could have ways technically to monitor what was happening statewide in the case of an emergency. The Gates Foundation helped set up a state-of-the-art emergency operations center in Lagos, in Nigeria, I'm not sure in what city. It was meant to help them achieve polio eradication there. And then, as you remember, just a few months ago, Ebola, someone from Liberia, Ebola got off the plane in Lagos, infected about a dozen other people, led to a chain of transmission, and they actually used the Polio Emergency Operations Center to help manage the response against Ebola. It was done successfully. In my own work in the Ivory Coast just in the last 2 months, we were also trying to work with the Ministry of Health there to have them set up something like this. But it's a good example about how infrastructure which is developed for one disease can then be used for another disease as well. All right, back in the 80s, look at all the countries that had polio, and we've just shown in red. The US was already polio-free. I think our last cases of naturally occurring polio were in 1979, I believe, in Pennsylvania. And then you can look, already by 2003, only a few countries showing up in red. Those are the countries where polio transmission had never been stopped. So we got India, very tough, Pakistan, Afghanistan, Egypt, Nigeria, and Niger. That's 2003. The countries in green are countries that have been reinfected by countries which still have polio going on. And then, so this is, don't look at the details, just look at arrows. This just shows that because of international travel, you can have people carrying polio on a plane, they get off the plane, infect someone in another country. This is the kind of thing we went through for the last 10 years, very complicated. 2007, main thing to look at here would be the dots. Northern India, this is, if you know the states in India, this is Uttar Pradesh and Bihar. Here is Pakistan, and across into the border with Afghanistan, a place with lots of security issues, and Nigeria. And these other few dots, those are cases that came out of Nigeria. So this goes on and on for years and years. This is 2014. As of last year, down to very few countries. Now, Nigeria is tough because what's up here in the northeastern part of Nigeria right now? Boko Haram, which is a terrorist group, which made it dangerous for vaccinators to go there. But very clever work was done by WHO, actually doing kind of hit and run vaccine campaigns quickly and then coming out and trying to keep safe. And then so we've had actually no cases in Nigeria now for the last 6 months or so. So the world is now down to 2 countries, Pakistan and Afghanistan. And a lot of it is here in the northwest border of Pakistan, which we know is a very difficult and dangerous place to work. It's interesting to see how a health issue is now involved with political issues and conflict. So we don't have to look at all this or this. The World Health Organization divides the world into different regions. So we are the American region, there's the African region, European region, Western Pacific in red, Southeast Asia in purple, and all of those regions have eliminated polio. We're down now to the Eastern Mediterranean region, and those are the last two countries. So actually, a huge effort is going on there, even as we speak this minute. The Pakistanis especially are they don't want to be the last country in the world to still have polio going on. They're making huge efforts, as we'll see in a minute. One of the things that they're doing in Pakistan is to help avoid Pakistan infecting other places. You cannot even get on a plane out of Pakistan to go to London or New York or anywhere unless you have a certificate showing that you have a recent immunization against polio. Otherwise, you get your polio vaccine on the way out. Otherwise, you can't go. That's to avoid those kinds of errors that we've seen before. Okay. Now, what is it like to work along the Afghan-Pakistani border? This is from the New York Times just a couple of days ago. Taliban assassins target Pakistan's polio vaccinators. So there are people now, sometimes nurses, sometimes community workers, who are doing work, risking their lives in order to be able to eliminate polio from these dangerous border areas and help make the world safe once and for all. This is really extremely dramatic. Numbers of killings have not been that great. They now deploy vaccinators along with police and military and so forth. And this says, this is February 27th, New York Times. Pakistani officials issue arrest warrants over refusals of polio vaccine. And there are certain areas, these are kind of the tribal areas in northwest Pakistan, where for cultural, religious, and political reasons, the population is refractory, and yet this is the last real holdout of polio transmission in the world. So the government there is really pulling out all the stops. This is rather a dramatic thing to do. And there's a bit of U.S. history involved here also. Remember a few years ago, I think it was Navy SEALs, and they were sent to assassinate Osama bin Laden. Do you remember that? How did they know in what house he was? Well, this is not quite correct. This says, resistance to polio campaigns increased significantly after the 2011 raid by American forces that killed bin Laden, amid revelations that the polio campaign had been used by the CIA as a cover. I think it was not polio, thank heavens. But it was in the guise of a hepatitis vaccine campaign, someone going door to door and trying to see who lived where. So that the benefit of that was that Osama bin Laden was killed. The downside is that this contributed to some of the resistance that we have now to eradicating polio in this particular area. Shows again the interplay between politics and health in this particular area. I just made this up this morning to try and give some sense of what polio, we have no polio here, but what does it cost? In South Carolina, we have about 60,000 births a year, between 50 and 60,000. Nationwide, about 4 million births per year. If every child gets 4 doses of vaccine, and the cost is not counting the doctor's visit, it depends if it's public or private, but roughly, we have about $500 million per year. Probably safely multiply that by 2. Over 10 years, that would be $4 or $5 billion. In fact, that's what the cost of now eliminating polio from the world is going to be. That's the kind of savings we can have in this country. Just like we don't have to give smallpox vaccine anymore to any child. Once this is done, we won't have to give polio vaccine to any child ever again. This is WHO's strategic plan and endgame plan for 2012 to 2020, and different things going on. Main thing is to get Pakistan back on track. Everywhere else, things are gone, except Afghanistan. It's going to be a little bit tough also. Goal is, they said by 2014, I think it's possible by 2015. We are really very, very close now, okay? This huge effort that's gone into eradicating polio actually is not just to be construed as something which is just only for polio. I'll give you an example. For polio vaccine to work properly, it has to be kept refrigerated at a certain temperature. And the vaccine is not made in India or Pakistan. So it's coming from London or Paris or someplace. From the time it leaves the factory until it gets into the mouth of the child, it has to be kept at a certain temperature. That's called the mechanism for doing that is called the cold chain. But the cold chain is valuable for other vaccines as well. So there are many legacies that are possible from this here. What's at stake? Can we do it? Yes. Can we afford to fail? No. Will it be easy? No. They're not. It's a very difficult area. That smallpox, that was gone. The one human disease which has been eradicated from the world. Give that for perspective. If you go today, I took this morning from the CDC website, and you look here, they're featuring measles, something we can talk about. Here's Ebola, here's influenza, here antibiotic-resistant organisms. So infectious diseases are very much on the plate in this country. I think this is the last slide here. This is just showing air routes around the world, and you can see that all countries are connected. The lines used to heavily connect, especially Western Europe and the US and Japan, but now you have China, and now you have emerging economies also in Africa and South America. So we also have not only horizontal links, but also vertical links. So a disease anywhere, one morning can be in our house by the next day. So I hope that gives you some perspective. We're very, very close, and Rotary obviously is playing a huge role in this whole process. So I think we'll stop here. It's getting close to 2 o'clock. Okay, thank you very much.